Hi, my name is Ryan Yamauchi, and today I will hopefully teach you a little bit about orgasmic disorders. First, let's start with what is female orgasmic disorder. According to the Diagnostic and Statistical Manual of Mental Disorders, which is the primary handbook that psychologists use, there are two types of orgasmic disorders for females. First is primary, which is when a woman has never had an orgasm, and secondary, which is when a woman has had an orgasm in the past, but acquired the disorder after sexual trauma, an operation, take a new medication, or it can be situation specific, which means that perhaps certain situations just don't work. Also, a note on primary is that this is even true even if a woman directly stimulates herself, she still can achieve an orgasm. However, to receive the diagnosis of having female orgasmic disorder, a woman must not have any other major mental health problems, as that can be a major contributing factor. And as stated earlier, if a woman can achieve orgasm through direct stimulation, it does not count as female orgasmic disorder. Some physiological causes of female orgasmic disorder are damage to blood vessels of the pelvic region, spinal cord lesions or damage to nerves in the pelvic area, side effects of medications or illicit substance abuse, removal of the clitoris, also called female genital mutilation, which is still a cultural practice in parts of Africa, the Middle East, and Asia. Psychological causes of female orgasmic disorder include psychologists mostly attribute past sexual trauma or emotional abuse, but other factors include fear of becoming pregnant or contracting sexually transmitted diseases, fear of rejection by a partner, self image issues, relationship issues, other life stresses such as job loss or family worries, guilt about sex or sexual pleasure, religious or cultural beliefs about sex, or other major mental health disorders as stated earlier. How is female orgasmic disorder diagnosed? Um, so, first of all, it must have had to happen over an extended amount of time relative to how long that they have been sexually active. Must cause emotional distress or difficulties in a relationship. And it must be either purely psychological or a mixture of psychological and physiological. It won't be diagnosed if it's for physiological reasons alone, as stated earlier, like if you had surgery or taking different medications. Also, it won't be diagnosed if it's a symptom of another psychological disorder. How can it be treated? If it's a physiological problem, it is handled physically, um, which means that maybe taking other medications that counteract it or reversing something. If it's an emotional psychological problem, a combination of sex counseling and sex therapy are used. Education about educating the woman about safe sex and basically just making sex kind of a non-taboo. Counseling maybe about past sexual history or past trauma that has been encountered, and sex therapy to decrease sexual inhibitions and stigmas while increasing sexual education and exploration and relaxation. Next, we'll cover male orgasmic disorder. This refers to the difficulty a male might have in achieving an orgasm. The process of arousal has a strong physiological and psychological factors, as the penis has to become erect and must be generally relaxed. Um, the psychological part comes from achieving an orgasm, as it has been somewhat proven that it is a psychological and hormonal issue. Some physiological causes of male orgasmic disorder is if a male does not produce enough testosterone from natural causes, medication, or surgery, thyroid disorders, pituitary disorders, diseases that affect the nervous system, surgery affecting the prostate, diseases of the penis, substance or alcohol abuse, and certain medications. Psychological causes of female orgasmic disorder include depression, feelings of guilt, anger, fear, low self esteem or anxiety, fear of the partner getting pregnant or contracting a sexually transmitted disease, having excessive stress in life or in the relationship, past history of sexual trauma, and these also go along with the other causes of female orgasmic disorder. What is premature ejaculation? Another topic, premature ejaculation, is when a male experiences an orgasm and ejaculates too soon after sexual stimulation and arousal. There's no formal cutoff time that qualifies as premature ejaculation, but the International Classification of Diseases states that premature ejaculation occurs within 15 seconds of the beginning of sexual intercourse. However, some other sources, such as Mayo Clinic, um, not a government or health primary health resource necessarily, but they often suggest 1 to 2 minutes qualifies as premature ejaculation. What are the causes of premature ejaculation? Although it lacks evidence, many theories suggest premature ejaculation may have occurred to masturbating too quickly during adolescence to avoid being caught by an adult, and may be also due to certain medications that are taken. So, how do you treat it? How you treat premature ejaculation? Most 75 to 80% of men self-treat premature ejaculation. The rest of the 20 to 25% do actually take medication or topical treatment for it. Um, that mainly attempts to decrease the sensitivity and the feeling of stimulation. There are a lot of risks that I've read online that are inherent to this, but still, men do go this route. Some self-treatment ways, which is the way both the bulk of a men try to do this, is they may try to focus their attention away from the sexual stimulation. Use a condom or even 2 condoms to decrease sensitivity. Withdrawing the penis for a certain amount of time. Thrusting slower or ejaculating prior to having sexual intercourse to decrease the desire to ejaculate. Meaning to masturbate maybe a couple hours prior. Next, we will cover retrograde ejaculation. What is retrograde ejaculation? Retrograde ejaculation has to do with semen going into a man's bladder instead of coming out of the penis because the bladder neck muscle, which is the same muscle that holds the urine inside your bladder until you urinate, does not tighten as necessary. It has nothing to do with attaining an erection or having an orgasm. So basically, like I said earlier, semen goes into the bladder, which either can cause very little semen or no semen at all to come out of the penis when having an orgasm. Some symptoms are dry orgasms or orgasms in which you ejaculate very little to no semen. Urine that's cloudy after orgasm, and this is because it contains semen, and inability to get a woman pregnant. Retrograde ejaculation is only harmful if you're having to have a child. However, regardless, men who have retrograde ejaculation should see a doctor to be sure it isn't caused by another issue. How to treat retrograde ejaculation? It can be caused by certain past surgeries or medications that are taken. If past surgeries are causing retrograde ejaculation, unfortunately, little can be done now. But medications can counteract other medications that are currently taken to achieve ejaculation. There are also medications to promote the tightening of the bladder neck muscle, and there's also a way to retrieve semen out of the bladder and manually insert it into the woman. And that concludes my presentation. Thank you very much for watching.